Hello, Internet. Here we go. Oncology, is it a science or is it an art? That is my topic for today. It just came to me a little while ago based on some things that have happened in the last week or two. Um, and as you guys know, I sit down to do these videos without an agenda. But right before I picked up the camera, I just thought, gosh, that's where I'll start. You never know where we're going to go in the next 6 or 8 or 10 or 15 minutes, but that's where I'm going to start. I was at Mayo Clinic last week for my 3-month restaging appointments, labs, CT scans of the chest and the abdomen, pelvis, and then, of course, my consult with my oncologist, Dr. Peterson. And it was quite an eventful day, actually. I had my labs first, and then I went straight to CT. And as I was sitting in the room to get my port removed, because I had a port access placed for my blood work and for the contrast that goes, the barium contrast that they inject into me for my CT scans. They had to remove that port access. So I was sitting in the room, and it was taking a long time for somebody to show up, and I wondered what was going on. And then a nurse came in and she said, "We need to take your blood pressure, we need to take your oxygen level." And I was like, why? That's something that we never do after a CT scan. And she said, well, your provider, which means Dr. Peterson, is looking, is wanting to check on some things. To make a long story short, when we finally got all that done, it was another probably half hour before they removed my port access stuff. The nurse said, "If you feel any shortness of breath or any lightheadedness or dizziness, please go directly to the emergency room." And I thought, this is bizarre. They never talk to me like this after I've had a CT scan. And so, of course, I started wondering and worrying what was on my CT scan. What did they see that they're so concerned about? And amazingly, I had barely walked out of the office. It had only been less than an hour since my CT, and already the results popped up. My phone was beeping at me with notifications that the results of my CTs were already there. And that is so amazing. I mean, Mayo is very quick at getting those results onto the portal and available to see, but an hour or an hour and 10 minutes is really quick. Usually it might be 2 or 2.5 or 3 hours. But anyway, I found a chair to sit down and took some deep breaths, because it's always very nerve-wracking to see CT scans after a period of months, wondering, okay, has my treatment been effective? Number one, but then also all of this hullabaloo with shortness of breath, go to the ER, and checking my blood pressure and my oxygen level. All of that was unusual. So I was like, what the heck is going on here? So I opened my CT scans. The first one was chest. And I opened that, and immediately I saw that the 2 little pulmonary nodules that we have been watching for a long time, that have never grown bigger than 5 millimeters, had shrunk down to 2 millimeters and 3 millimeters after this course of treatment that I've been undergoing for the last few months. So that was great news. And as far as the cancer, the disease is concerned, there was nothing else in that CT report. So I was thinking, wow, great news. However, the other part of it is brand new subsegmental pulmonary emboli, which is a very technical way to say small blood clots in my right lung. And that was the reason why they were all freaking out. These are brand new. They are treatment related. They are subsegmental or subsegmental means it's on the periphery of my lungs and it's in kind of dead end little blood vessels. So these are not, they're not worried that they're going to break off and, go to my heart. They've already been through my heart and sent to my lung. But they were just concerned because these, even if they're very small blood clots in the lung can cause, respiratory issues, shortness of breath, lightheadedness, dizziness, etc. And that could explain why I was dealing with some of that stuff a few weeks ago, as you guys may remember. So that's what happened last week on Tuesday. And I ended up getting, they ended up making an appointment with a vascular specialist, like right on the fly. In fact, I went up, they gave me a call and said, go up and see this guy. And it was just a half hour before I was scheduled to meet with my oncologist later in the day. This was like 4 hours later in the day. And the bottom line of all this is he told me that it was not immediately threatening or really an emergency, but yes, my treatment, and it's quite common with cancer patients when you have chemotherapy, targeted therapy, immunotherapies, toxicity, anemia, lots of different issues where your blood can clot more easily. So the bottom line to the whole thing is that he told me not to worry, but that he wanted to put me on an anticoagulant for the next 3 months, and that would be Eliquis. And most of you are very familiar with Eliquis. I've got family members who are on Eliquis, and you probably do as well. So anyway, in addition to everything else that's going on, I am now on Eliquis for the next 3 months. And of course, that is a little bit dicey when I'm in the middle of cancer treatment, or not in the middle, but at the end of my latest cancer treatment, because already, as you know, I've got bleeding issues on my scalp, my fingers, the soles of my feet. I have a couple of spots that are bleeding. So we have to keep an eye on that, but okay, that's part of it. Now back to oncology. Is it a science or is it an art? I am sitting here today on May the 5th, on the day before I am scheduled to have my 8th cycle of treatment. It's on the schedule, but we all know, my oncologist team in Mayo, Dr. Peterson and company, and then also Dr. Zhang and my oncology people at Minnesota Oncology, we all know that we're not necessarily going to go through with that treatment. Mainly just due to the fact that I'm beat up from side effects ever since January the 7th when I started this round of cycles of treatment. So when I met with, so tomorrow I will be going to meet with Dr. Zhang, and we will discuss my scans and everything related to my meeting with Dr. Peterson last week. And Dr. Peterson herself was awesome as always. I really appreciate her and love her a lot. Basically, as I said, from a cancer standpoint, my chest and pelvic, abdomen CT scans had very good news. Every single thing is shrinking or disappearing altogether. There is absolutely nothing on those scans tangible that we are worried about as far as my cancer itself. And that means that once again, the treatment that I've been dealing with ever since January the 7th has been effective again. I had that ablation in February, and of course they got rid of a spot in my liver from that one. And so from a cancer perspective, everything looks good. And Dr. Peterson and I had a long conversation about what do we do? Stop now, or do we try to continue on with some sort of maintenance therapy? A new term is called, it's called, shoot, interval. Darn it, why am I blanking out? I'll skip that for now. I'll go back to it. It's a terminology meaning to increase the timing between doses. So instead of every 2 weeks, maybe do it every 3 or 4 weeks. And that is like an interval dosing. And then you can also reduce doses, like go down to my last 2 doses have been 50% of panitumumab and 80% of the 5-FU pump. So we are talking about the best strategies. And she was just telling me about different studies, research studies, clinical trials, and that there's very, very little data on this whole interval maintenance therapy where you stretch out the treatments and you reduce the doses, but you continue them during times when normally you might have a chemo break. Now, I know that Dr. Zhang here in the Twin Cities is kind of creative in that he wants to try some maintenance dosing on me and some, that's it, stretch interval is what they call it, because they stretch out the times between the doses. He would like to experiment with that with me over the summer, because he's talked about, let's try to get down to the micro level. Even if we're getting rid of the visible, observable disease, what if we try to get further down into the micro level? And here's where art versus science comes in. Dr. Peterson told me she would prefer that I take a break. She said, you have been beat up by side effects, which I have. The fatigue, the skin issues. I'm still dealing with an itchy, scabby scalp that's bloody at night on my pillow. Ugh. You guys know, I've talked about that enough. All the lotions and creams, and just the fact that I'm very fatigued every time I get my dosing for like the 4th and 5th day, the sledgehammer effect, I call it. I'm tired, and summer is coming. I'm also extremely photosensitive due to the cancer treatment and the antibiotic that I'm on for skin issues. So here we are in May. We're getting to the brightest and sunniest and highest sun angle times of the year. And I don't want to be photosensitive and feeling like crap for the summer. At the same time, I want to be open to some creative therapies in terms of this stretch interval or maintenance stuff. So anyway, the bottom line of the conversation, Dr. Peterson said, I won't be mad if you and Dr. Zhang decide to do some kind of maintenance stretch interval stuff over the summer, but my advice to you is you deserve a break. That's what she told me. So I've been mulling that over, talking it over, praying about it, just processing it with family, and I've blabbed a lot about it with everybody that's close to me in my life the last few days. And the bottom line is, tomorrow I will meet with Dr. Zhang, and we will discuss what happened at Mayo last week, the fact that I'm now on Eliquis and that I have a higher bleeding risk than I had before. And I will tell you the honest truth. I am leaning towards taking a break that I deserve, which is what Dr. Peterson has advised and suggested. But at the same time, I am also open to Dr. Zhang maybe persuading me to look towards some sort of maintenance stretch interval therapy over the summer, like maybe after a month from now, or a couple months. I'm not gonna close my mind to that, because I'm also interested in some of these newer artistic approaches. And again, that's why I was talking about, again, back to my appointment with Dr. Peterson last week. one of the last things she said as we left is she said, you know, oncology can sometimes be more of an art than a science. And that really stuck with me. I was like, wow, that's cool. I'm a meteorologist, and I know very well that meteorology and the communication of weather stuff can also be sometimes just as much of an art as it is a science. And so those of you who are in scientific fields maybe can understand that there is always art mixed in with the science. So I will post another video after several days, you know, letting you know what Dr. Zhang and I decided. But at least as of right now, this evening, I am planning to say I want to be done with my treatment. I don't want any more drugs pumped into me. Let's stop. And, you know, whether we decide to resume some sort of maintenance treatment later in the summer or not, I will have my next scans at the very end of July. And then we will, of course, reevaluate as we always do. So anyway, you guys, thank you for bearing with me. Sometimes I know this gets like down and deep in the weeds, and there's some of you that are very interested in the details, and some of you, maybe it just goes like this, and you're like, ugh, stop, pause, close. We're all, I know that I have viewers like all across the spectrum. There's close friends and family that want to know all the details, and there's other people who maybe are just dipping in and out, and I don't know you, you don't know me. So there's that spectrum of viewers here. And yeah, I just enjoy connecting with you guys and sharing what's going on and hoping that it's relevant to you. So thank you to all of you. 17 minutes. As much as I try to keep this to 10 or 12 minutes, it just rarely works that way. So anyway, I will be back in touch with you with more information in a matter of time, maybe a week or 10 days or so, or before that if there's something really huge that I want to communicate. Otherwise, love to all of you, and thank you, and welcome to the month of May. I hope it's a good one wherever you are.